Hey everybody, Jamie here. So in New Brunswick right now, there's a brutal measles outbreak. The province has confirmed 44 cases of the disease, and there are actually 100 confirmed cases nationwide, the biggest outbreak in Canada since 2019. About 2/3 of these cases are in people who have not been vaccinated against the disease. Routine childhood vaccination rates have been falling in recent years. The anti-vax movement saw a surge during the pandemic. And now, longtime anti-vaxxer Robert F. Kennedy Jr. is set to lead the U.S. Department of Health. To talk about all of this, my guest today is Timothy Caulfield. He's a professor at the University of Alberta in the Faculty of Law and the School of Public Health. He's an expert on health misinformation, and this is something that he's been watching very, very closely. Timothy, hi. Thanks so much for coming on to the show.
Thanks for having me on.
But before we start talking about the state of the anti-vax movement, I just wonder if I could get your reaction to this measles outbreak. Like, what goes through the head of someone like you when you hear the news?
I can't help but be really angry. And look, there's a whole bunch of factors at play here. Access to vaccines. There's vaccine fatigue because it's just been a topic for so long. But there's absolutely no doubt that this is largely a story of vaccination hesitancy. We know that hesitancy rates for not just the measles vaccine, right, are increasing. We're seeing it in the United States and in Canada. We're seeing it for HPV. We're seeing it for the flu vaccine. Of course, we're seeing it for the COVID vaccines. There's just this horribly destructive trend of, an anti-science trend for this increasing hesitancy. So when you hear stories like this, it's maddening, right? Because as you said off the top, we know the measles vaccine is incredibly effective and incredibly safe. And by the way, around the world, 107,000 people died
Wow.
of measles last year. Mostly
Wow.
kids, right? Those are deaths that could have been prevented if we had, a strong distribution of the measles vaccines. In the United States, a recent study found that about 30% of people believe the vaccines cause autism lie. Now, 30% believe are open to, and that is an increase. So the belief in that lie, that hardcore lie, is increasing, and that is totally the fault of anti-vaxxers, and for sure, RFK Jr. has played a huge role in that increase.
I wonder if you could help me put just maybe a few more numbers on this. So, in terms of vaccination rates, do we have a good sense of like how much they have been falling and for which vaccines, particularly since the pandemic, since 2020?
Well, it is difficult to put an exact number on this because, depending on how you ask and what is the nature of the hesitancy. But the number I just gave is a really good example. If you look at the numbers for belief in misinformation about vaccines, that's another really good indication. So things like the COVID vaccine, killed more people than it saved. The COVID vaccine will change my DNA. The ivermectin works. These things that are demonstrably false, right, from a scientific perspective. Not we need to be open-minded to outside sort of scientific ideas. These things are demonstrably false, and studies have shown that belief in those lies is increasing in both Canada and the United States. If you ask people why do you have this hesitancy, largely it's not about some very nuanced perspective on distrust of institutions or this nuanced belief in what the science says about who should be getting the booster. The distrust, the hesitancy is justified using misinformation, like the ideas that I just rolled out. So we know,
Right.
that misinformation is playing a big part in this increase in hesitancy. There's complexities here for sure, because what is the arrow of causation? In other words, do you have this hesitancy in your gut, and because you're part of this political community, for example, and then you reach for misinformation to justify the hesitancy, or did the misinformation cause the hesitancy? In some respects, when you're talking about the increase in hesitancy that I just described, it kind of doesn't matter, because the hesitancy is still doing, or the misinformation is still playing a big part in that increase and the justification for that increase.
The people who have these beliefs, do we sort of have any sense of who they are? Maybe in terms of demographics.
We do. We do. And it's a fascinating question because it's shifted. It's definitely shifted over time. We know that hesitancy is playing a huge, increasingly big role right now. And we know that that hesitancy resides on a very particular side of the ideological spectrum. And let me just give you some numbers here. In the United States, your political identity is more predictive of whether you are vaccinated for COVID, and really I think this goes for almost every vaccine now, than race, income, education, insurance coverage, age. It is the number one predictive variable. And that is true in Canada too. We have less research on it in Canada, against another topic that we're researching at our institute. But let me just give you this one survey that was done by a colleague of mine, Frank Graves, a survey expert in Alberta. And he found that, I believe the number, I'm going to be careful to get this right, I think it was 93% of the unvaccinated, those individuals who didn't get a vaccine, didn't get the COVID vaccine, voted for the Conservative Party in Alberta.
Right.
And I think it's 3 to 5% of the unvaccinated voted for the NDP.
Right.
That is a huge split.
This is very interesting to me because this actually wasn't always the case, right?
Yeah, I think this is very, very important because, as soon as you start rolling out these numbers and you can feel the anger in my voice, right? You think, oh, Caulfield's just being super partisan. He's a ideological hack. It wasn't always like this. And you could say that more broadly about alternative medicine and the wellness industry. For most of my career, this kind of resided on the left. It was about, it was new agey approaches to health. It was about different ways of knowing. It was about natural. It was about being counterculture. There's been studies that have shown that in the 70s, it was the Democrats in the United States that were anti-science and the Republicans that were strongly pro-science, right? So it was
Yeah.
Vietnam War, Agent Orange, Watergate, and now we've seen a complete flip. I can give other examples on and on. But so it's really important to recognize it's this cultural moment, and it's largely emanating
Yeah.
from the right.
And just take me through what you think caused the flip, right? Like what you think caused the flip.
So again, you're gonna hate my answer. It's complex. It's
Yeah,
complex.
we got a lot of those on this show. Yeah.
I do think there are interesting threads, right? So I make it sound like there was this complete shift, but there are these threads that were always there, like suspicion of institutions, right? You saw that on the left and on the right. Certainly, during the Vietnam War and Watergate, and so you're seeing that thread continues, right? Also, this idea of empowerment, taking control of your life. I think you see those threads there. But in the past, when you're talking about health misinformation, which is the area that I study, it was never this political, right? There were all politics was always there, was kind of lurking in the background, but now it's central. So the other thing that I think has happened is there's this cycle where being anti-vax is being part of this community, and therefore it becomes more valuable for politicians to either explicitly or often implicitly kind of endorse the conspiracy theory or the idea, thereby making it more of an ideological flag for that community. And the cycle kind of accelerates, right? And we've seen that happen in the United States. So in other words, it becomes more politically advantageous for politicians and people within that political community to use these topics as an ideological flag, right? And
Yeah.
we see that with topics on the left and on the right, and we could talk about nuclear power and GMOs on the left, right? And then on the right, you see it's becoming vaccines and gender politics. These are wedge issues that allow belief in the conspiracy theory to accelerate and the scientific data to kind of rescind in relevance. It really all becomes about the ideological flag.
And fair for me to say that the pandemic might have like supercharged this.
Oh, for sure that it did. And this has to do with distrust, and I think you see populist parties taking advantage of that distrust, like don't trust, the elites, which is a common theme, as everyone knows, in populist politics, and that became the norm, and it's become the norm to such a degree. One of the things I'm both fascinated with and infuriated with, that as I said at the outset, demonstrable lies for particular communities are held out as truisms, right? So if you don't believe this lie, you're the enemy, right? They become
Mhm.
ideological tests.
You just did this documentary for The Passionate Eye, which is great, by the way, all about the manosphere and the idea of wellness. The manosphere is something that we've talked a lot about on this podcast lately. Of course, it dovetails with all those right populist politics. And just tell me more about the role that people like Joe Rogan and Theo Vaughn and other big manosphere influencer types have played in this movement.
It's huge. It's absolutely huge.
If you're like 21 years old and you say to me, should I get vaccinated? I go, no.
Yeah.
Are you healthy? Are you a healthy person? Like, look, if you're a healthy person and you're exercising all the time and you're young and you're eating well, and like, I don't think you need to worry about this.
I grew up next to the Primate Center in Covington, Louisiana. It's where they even created the polio vaccine. And the vaccine gave cervical cancer to millions of women. But they'd already made the vaccine. The government.
Let's just reflect on a relatively recent study about where individuals are getting their information, right? So this study came out, I'm going to say last week, and it found that for those under the age of 30, 40% of those individuals get their news, their facts about the world from an influencer, which is incredible,
Wow.
right? And
Wow.
2/3 of those influencers are men, and most of them lean right. So think Joe Rogan, right? That's the first individual that pops into your mind. So this is where individuals are getting their facts about the world. They're getting the facts about the world from these individuals, right? These aren't journalists, these aren't scientists, these aren't researchers, these aren't people who are aggregating the evidence in a responsible manner. These are influencers. And so they are playing a massive role. And the whole manosphere has been embraced. And we know this had an impact, and the numbers back this up in the United States, in American politics. And you're starting to see it happen here.
Yeah, and vaccines are a big part of that. Fair for me to say.
It is. I think it is fair to say that. And there's really interesting research about how the manosphere has influenced perspectives on other public health measures, right? Like wearing sunscreen. An interesting study that came out recently showed that, real men don't wear sunscreen. The Liver King does not wear sunscreen. And, if you eat a carnivore diet, in fact, you don't need sunscreen, apparently. Not true, obviously. Real men don't eat lots of fruits and vegetables, and this kind of perspective. And the other studies have shown that those who adhere to traditional masculine norms just don't follow public health measures as much as others. And again, we have to be careful not to overinterpret this data, because it is correlational, it's observational, right? And there might be other variables, baked into that data, socioeconomics, education. But definitely the trend is there. And it's also associated with, traditional masculine norms are also associated with risky behavior that's bad for you, right? So more drinking, smoking, unprotected sex, on and on and on. And it's also associated with domestic violence. And, it's not a healthy trend, I'll put it that way. And I hope that comes across in the doc.
Having said all of this, on the topic of vaccines, like I'm just curious where women fit into this, right? Because it is often the case that in a lot of households, it's the women that are the ones taking the lead on making healthcare decisions for their children. And so what role are they playing in this dynamic?
They play a huge role, and I think traditionally that women are have played a huge role in the anti-vax narrative. And again, want to be careful not to overgeneralize. It's complex, right? But if you look back, big picture to people like Jenny McCarthy, and the idea that vaccines cause autism.
Without a doubt in my mind, I believe vaccinations triggered Evan's autism.
Parent after parent says, I vaccinated my baby, they got a fever, and then they stopped speaking and then became autistic.
Oprah kind of emboldening that idea.
I'm here with Jenny McCarthy, who's become one of the most vocal advocates for parents of children with autism.
Yeah, I remember that so well.
Yeah. That's absolutely, that's moms, and they were held up as heroes, right? That, autism warrior, I think is what CNN called Jenny McCarthy, which is, just horrible, right? We're talking about, a vaccine that can save lives, and how many deaths were caused by that completely false idea. Question mark.
I want to talk to you about RFK Jr. Specifically here. So this is a guy with a long public record of vaccine skepticism and other dubious claims about health science. And maybe just talk to me a little bit about what he's said about vaccines, but also what you think the implications of having someone like him in that sort of leadership position as the head of the U.S. Department of Health.
Well, first of all, I think off the top, it's really important to emphasize he is not a vaccine skeptic, right? He doesn't have controversial views on vaccines. He is a hardcore anti-vaxxer.
I see somebody on a hiking trail carrying a little baby, and I say to him, better not get him vaccinated. And he heard that from me. If he hears it from 10 other people, maybe he will save that child.
And I really worry about how we're seeing, I'm sure you've heard this phrase, the sane washing that is happening with RFK Jr.
That's a really good point. Yeah.
Yeah. He always says, I'm not anti-vax. I just want, safe and effective vaccines.
I have never been anti-vax. I have never told the public avoid vaccination. The only thing I've asked for, and my views are constantly misrepresented, so that the truth of what I believe is not, we're not allowed to have a conversation about that with the American people, which I believe vaccines should be tested with the same rigor as other medicines and medications.
He has pushed vaccine lies, right, that have definitely contributed to the increase in vaccination hesitancy. And people have presented him with, here's this mountain of data that counters the lie that you just push, and he ignores it. And he rolls out an anecdote or just makes this assertion.
There is very, very strong science, really overwhelming science, linking those autism rates to the thimerosal that was in the vaccine.
I bet that you've never met anybody with full-blown autism your age. Headbanging, football or helmet on, non-toilet trained, non-verbal. I mean, I've never met anybody like that my age, but in my kids' age, now 1 in every 34 kids has autism, and half of those are full-blown, meaning that description.
He's claimed that HIV doesn't cause AIDS.
There's a lot of people that said it's not a virus. The virus is a passenger virus. And these people are dying mainly because of poppers. 100% of the people who died in the first of the first 1,000 who had AIDS were people who were addicted to poppers, which are known to cause Kaposi sarcoma in rats.
He makes ridiculous comments about things like fluoride.
I think fluoride is a poison.
But in the context of vaccines, that he's probably done the most harm, right? When you just think of things like the autism is caused by vaccines lie that has been disproven over and over and over again, right? So he is a hardcore anti-vaxxer. The concern is that he is going to totally normalize this kind of rhetoric. And we're already starting to see this in the legacy media. Or they'll say, well, he has got interesting ideas about healthy lifestyles, which absolutely infuriates me. And I know it infuriates all of my public health researchers, who have been studying this for decades and advocating for healthy lifestyles.
Can he, one question I have for you is can he do damage beyond the way that we talk and think about vaccines? I'm thinking about like the FDA here, right? Which gives approvals for vaccines, for drugs. It's an administration that Canada basically follows.
Yes, I think, and also just in the context of research, right? One of the projects I'm working with the scientific community, biomedical researchers on mRNA vaccinations. And the concern is that the research priorities in the United States are going to change, right? And that's going to have an impact on Canada, because let's be honest, the NIH is the biggest funder of research on planet Earth. I think that statement is true. And so what they fund, what their research priorities are, has an impact on Canada and really on the world. The other thing, of course, is a lot of the biomedical companies reside in the United States, or at least at a minimum, the United States has a huge impact on the priority of industry in this space. That's going to have an impact.
We've been talking about how these beliefs are so entwined with people's personal and political identities. And I would imagine that would make it so hard to change someone's mind about it, right? And so what do you see as like the way forward here for scientists, for public health experts like yourself, maybe for somebody listening who's trying to figure out how to talk to a friend or an aunt or something like that, right? How do you try and counter this or fight back against it?
You're right. Unfortunately, the data tells us that the more this becomes about personal identity, about being part of a community, and I think we need to be sort of empathetic about that, right? That it's easy to rage against people like RFK Jr., but for our friends and neighbors and colleagues and family members, they're looking for answers, and they're looking for communities, and they want to feel safe. We have to remember that, right? But once you become part of a community, once this becomes part of your identity, it can be much more difficult to change people's minds. So I do think we want to listen to what the concerns are that drew people to these conclusions. We want to recognize the role of the community in their belief system. We need to also recognize that it's going to take time. Studies have shown that once you take on these hardcore beliefs, it can be very difficult, and you have to have patience, and you have to give people a path towards credible information. The good news is we're getting more and more research on this. People like Gordon Pennycook and David Rand have done research on using things like AI chatbots to answer people's questions and sort of pull them out of the rabbit hole. And they actually found that could be quite effective. The other thing we want to do is we want to just invite people to remember that this information is often playing to politics, it's playing to rage, it's playing to grievance. So if you do that kind of pre-bunking and you invite people to kind of pause and think about accuracy before they sort of internalize the belief, they're less likely to believe misinformation, less likely to spread misinformation. This is often called an accuracy nudge. So if you combine pre-bunking, like we're doing today, with an accuracy nudge, again, research shows that we can, on a population level, right, level, move the needle, but we can't give up. We can't give up. We can't let that candle go, in the darkness go out. We have to, keep fighting for for good science and reason as a path forward.
Okay. Tim, thank you so much for this. I really appreciate it. Please come by and do this pre-bunking anytime you want. It's great to have you.
Thank you so much for the opportunity.
All right. That is all for today. I'm Jamie Poisson. Thanks so much for listening, and we'll talk to you tomorrow.